Welcome to Live Better Without Surgery. I'm Dr. Joe Albano, your guide to exploring the innovative world of regenerative orthopedics. Join me as we uncover non-surgical solutions to move better, feel better, and live better. Let's get started. Today's title is Weight Loss Unplugged, Real Talk on Tirzepatide and Living Better. So, what's the deal with all these weight loss drugs now? I'm sure you've heard of these things: Ozempic, Mounjaro, Zepbound, and maybe you've seen your friend or neighbor or somebody who's been on these things. Maybe they've had a good result with it. So why are these so popular, and are they really any good for us? Let's look into this and see if we can figure out the answers to that. So, first of all, why are people even doing this? They're trying to lose weight, obviously. But interestingly, these drugs were not developed for weight loss. They were developed to combat diabetes and found that, oh, yeah, you have weight loss that occurs with this. So then FDA approval came after that for weight loss. But going back to why weight loss is important, for me in regenerative orthopedics, somebody's coming to me because they have knee pain, they have knee arthritis, and oh, wait, they need to lose 50 pounds. So oftentimes they've tried other ways to lose weight. Many times these people are in their 50s or 60s. And as we get older, we've just noticed it's kind of harder to lose weight than it used to be when we were 20 or 30. Weight is a big problem in the US right now. Every medical conference I go to, they talk about this and they put slides up showing how obese Americans are. And it's true. We are not doing well for all sorts of reasons. Diet is one part of this. And we can get diabetes if we're overweight. You can have two different kinds of diabetes. Type 1 is you're basically born with it, but type 2 is we develop it as we get older, and most of the times it's related to being overweight. And so you really want to prevent diabetes for lots of reasons. It's a bad disease to have. You can increase your cardiovascular risk, heart attack, stroke, dementia, eye disease, things like that. You don't want to get diabetes. And in my field, when we're talking about knee arthritis, for instance, if you lose 50 pounds, oh my goodness, it's going to help your knee so much, because for every pound that's up around your belly, that's 4 pounds of pressure on your knee. So you don't have to lose that much weight to have a big impact on knee arthritis. So it's definitely something that we look at and talk with our patients about. So really, how do you lose weight? That's the start of the discussion. And first is increase your cardiovascular activity. If you just sit on the couch and eat bonbons all day, yeah, that's not so good for you. You're going to gain weight, and you're just not healthy because of the weight, but also because you don't get the cardiovascular activity. Just the activity will raise your HDLs, which is one of the good cholesterols, and lowers your risk for heart disease. So just doing the activity, forget about the weight for a second, will help lower your risk for heart disease. But then also the weight part of this will be helped by the cardiovascular activity. So question for you: have you ever seen a skinny marathoner? Yeah, pretty much all of them. Not all of them, though. Have you ever seen a fat one? Pretty much never, because they just run too much. Now, I'm not suggesting that you need to go start running marathons, but that's just the example of more activity will lead to less weight. And I remember when I trained for my first marathon, I just couldn't eat enough food to maintain my calories. And I think I started off at about 165 pounds and I got down to about 145. And I wasn't trying to lose any weight at all. And I just couldn't eat enough food because I was doing too much activity, or so much activity. So cardiovascular activity, number 1. 2, decrease in calories. So how do sumo wrestlers gain weight? Do you know what their tactic is? They don't eat all day long, and they'll eat all their calories, 10,000 calories right before they go to bed. So it's not just the amount of calories, it's the timing of the calories. One of my friends, who is a really good trail runner and in the masters level, like national caliber, he's doesn't have any weight to lose, and he just didn't eat anything after dinner time, and the guy lost 10 pounds. And again, he didn't have an ounce to lose, and he wasn't trying to lose weight. But the point of that is timing matters. So ideally, you don't have anything to eat after dinner time, and you eat as early as you can. Another tactic would be to do intermittent fasting. We're not going to really get into that today, but if you decrease the amount of time you're eating your calories, there's some evidence that that may be a good thing. Now, you don't necessarily have to do that, but just timing before you go to bed is not a good idea to have lots of calories. So increase activity, decrease calories, and the timing of it. And sometimes it just doesn't work, especially as we get older. A lot of people have noticed that, I'm doing the same thing I've been doing my whole life, same activity level, eating the same stuff. And now I just can't lose the weight. And some of that has to do with our hormones. So thyroid is a key one there. So one of the things we look at are, what are your thyroid levels? And here we get into a philosophy. So what I was taught in medical school and residency and fellowship was, if you have a low level and a high level of any hormone, if you're in that range, you're good. You don't need to worry about anything. You don't need any medication. Well, that's not exactly true. What we like to do here is we like to optimize. So we want to bring levels, thyroid hormone is what we're talking about now, up to a high normal level. And that can help a lot of people. Here's an example of that. I see people, in this case, say for knee pain, right? And I bring up hormone levels, and let's pick a typical patient, a 40, 50-year-old woman, for instance, who says, oh yeah, doc, I've had my thyroid checked and it's normal, but I'm still so tired all afternoon. I can't believe it. Well, if you just optimize the T3 thyroid hormone on these people, they can feel so much better. And it's not always magic, but actually a lot of times it kind of is like magic, where they just feel so much better. And that's a fatigue thing. And they weren't even coming in for this. We're talking about their knee. And back to the weight loss part of this, though, everybody knows thyroid can play a role in or does play a role in your metabolism. And if you increase your metabolism, it'll help you with losing weight. So we look at thyroid hormones and make sure they're optimized. How about, you remember the Fen-Phen diet from back in the day? Or if you're old enough, you'll remember this. I had 2 patients talk me into giving this to them back in the day. You got to know my philosophy, though. So first of all, I'm not a guy to say, hey, yeah, let's take this drug and you'll magically lose weight. No. You need to change your habits. You do need to do the cardiovascular activity and watch your diet and what you're eating. And what I didn't mention about the diet part of this is the exactly what you're putting in your mouth does matter too. So carbohydrates, let's talk about that for a second. They're not so good. I'm Italian. What did we eat growing up? Pasta 2-3 times a week. Pasta with, we call it gravy, red sauce. Pasta with gravy and maybe a couple meatballs, salad, maybe if you're lucky, vegetables. Nah, who needs those things? Just carbs. And when I was doing my marathons and ultra marathons after that, everybody's really still saying, hey, you need to carbo load for the performance that you want. So you got to have enough carbohydrates in there. And I think that's not the way many people are going with it now. Personally, I'm kind of going away from that when I'm doing my long distance activities. You still need carbs, but not that many that way. So if you avoid carbohydrates when you're trying to lose weight, that goes a long way in helping you lose weight. So if you have more healthy fats like avocados, avocado oil, nuts, things like that, that's better for you. Animal fats, not so good. And protein, that's good for you too. And you can definitely get carbs, but get them through vegetables. That's going to go a long way also to helping you lose weight. So not just the timing, but what you're putting in your mouth. So back to the Fen-Phen. Okay, magic drug back in the day. It was touted as, oh yeah, you're going to lose so much weight. And you know what? People did lose weight. And these two women that I put on it, they did lose weight too. But then what was found was that, hey, people are having all sorts of bad heart problems from being on this combination of medications. So that got the kibosh and people weren't on that anymore. So my lesson learned from that was, yeah, you need to go back to cardiovascular activities, calories, timing, what you're putting in your mouth. All these things are helpful, but you need sometimes more than that, thyroid and not Fen-Phen. So then come along these GLP-1 agonists. So you've heard of these things, unless you live in some faraway land on an island somewhere. There's Mounjaro, Zepbound, um, Ozempic is another one. These are the most common ones that people are using. And so Ozempic is semaglutide, and Tirzepatide is the Mounjaro, and Zepbound, that's the generic names for them. And they were originally developed as diabetes medications and approved by the FDA in 2022 to treat diabetes. And then in November 2023, FDA got approval for the treatment of obesity because they found that, oh, wait, these medicines actually help people to lose weight too. And so then clinical trials were started on diabetes even way before that in 2018 and obesity in 2019. So these medicines have been around for a little bit of time, but not 20 years, not 30 years. We don't know what's going to happen over that long term, but we have some experience with these medications, starting in 2018. So at the time of this taping, it's 2025. So it's like 6+ years that we've had experience with these medications. So to understand about these, how do they work? First of all, they stimulate insulin secretion, and insulin will lower your blood sugar levels, hence treating diabetes. It also suppresses glucagon secretion, and glucagon raises blood sugar levels. So the net effect is that it will lower your blood sugar levels. And then the two ways that people really notice about this is it reduces your appetite, so it works up here in your brain, and it slows emptying of the contents in your stomach. So not only do you feel full, you are, because the food's just not leaving there like it normally would. And the last way it works is it seems to improve insulin sensitivity in peripheral tissues such as muscle and fat. So we started using these medications a few years ago with our patients that just weren't having success. They have knee arthritis, need to lose 50 or more pounds. They exercise, they're eating right, the timing, what they're putting in their mouths. We talked about getting them on thyroid medications and still not working. So what we found is that if we can just get them to be successful with losing weight, they have time to change some of these habits that they'll need to in there if that was a problem. And it's like a kick in the pants to get them in the right direction. And so we've done that now for a few years, and we found it to be really successful. I'll give you an example of one person. This is an extreme good example. One of my friends lost 25 pounds a month for 2 months, so 50 total pounds in 2 months, and has never needed to be on the medication again. That's not usually how it works. Usually it's much more modest decreases in weight, 5 to 8 pounds or so a month. And sometimes people do need to be on this later. They can be on lower dosages, but the plan is to not have people be on this long term. Use it as a kick in the pants, get them headed in the right direction so they can implement some changes and lose the weight, and then their knee's going to feel better. What are some possible bad side effects with these? Well, first of all, you're starving yourself. That's why you're losing weight. And then what happens? You're going to lose some muscle mass in there. So we want to minimize that as much as possible. So we need to do some strength training when you're on these medications. You need to increase your protein intake in your diet of regular foods, but also we recommend collagen peptides as supplements so that you don't lose as much muscle mass. And when we have somebody on these medications, we keep track of their body fat, their muscle mass at regular basis so we can see how well they're doing with this and evaluate what's going on and make recommendations like, are you really taking enough protein into your diet? Are you strength training, because you're losing a bunch of muscle here? And then just encourage them to do that. About 10% of the time you get GI side effects. That can be belly pain, constipation, diarrhea, reflux, and nausea, vomiting. These are the common ones that you can get with this. And this most of the times doesn't happen with Tirzepatide, but I see this more commonly with the semaglutide or Ozempic. And the Ozempic semaglutide just doesn't work as well as the Tirzepatide, Mounjaro, Zepbound. That's just what we've seen. And so we recommend people, if they're going to go on any of these medications, they will go on the Tirzepatide one. And then if it's successful, what happens later on? Maybe somebody's got a little pocket of belly fat that's left, or they just have lost too much muscle. We can help with that by using this Emsculpt Neo device that we have. It can decrease fat by up to 30% in a particular area and increase muscle by up to 25% in a particular area too. So we can use that to help. And usually it's the belly. So we can put it on the abdomen or on the flanks or edges, as it's called. So you can do that, and it can really help improve appearance, but also improve your muscle mass in there. So summary is that if you have extra weight, there's hope for you nowadays. You should start with increased cardiovascular activity, dieting, meaning eating the right foods and less of the wrong ones and lesser amounts and with good timing. Think about optimizing your thyroid. And I think it's okay to use one of these GLP-1 agonists, such as Tirzepatide, to help with this if you have to achieve your goals. I'll have people say to me, hey, doc, I'm not sure about these medications. They haven't been around that long. We don't know the side effects. They're not wrong about that. I talked about how long they've been around, and so far, we don't see any really bad side effects with that. But then you also look at the side effects of being overweight. What's the risk of diabetes? Way worse than with these medications from what I can see. So I think it's worth the risk to at least consider trying these medications. Thanks for listening to Live Better Without Surgery. I hope you found today's discussion enlightening and empowering. Keep in mind that non-surgical alternatives can lead to a healthier, happier you.